Now next is the taxonomy and the causal relationship between virus and diseases. One of the landmark in the history of infectious diseases was development of Henle-Koch postulates, Henle Koch postulates, which established the evidence required to prove a causal relationship between a particular infectious agent and a particular disease. These simple postulates were originally drawn up for the bacteria but were revised in 1937 by Rivers and again in 1982 by Evans EVANS in attempts to accommodate the special problem of providing disease causation by viruses. A special problem of proving disease causation by viruses. ये टेबल 2.3 में आपको मिल जाएगा. In many cases, virologists have had to rely on indirect evidence, guilt by association, guilt by association, with association based on epidemiologic data and pattern of serologic positivity in the population. The framework of the virus taxonomy again play a role, especially in the trying to distinguish an etiological rather than a coincidental or opportunistic relationship between a virus and a given disease. For example, early in the investigation of the human acquired immunodeficiency syndrome, yani AIDS, before its etiology was established, many kinds of viruses were being isolated from patients and may indicate etiologic agents were being advanced. Prediction that the etiologic agent would turn out to be a member of the family Retroviridae was based on the year in the veterinary research on animal retroviruses and animal retroviral diseases. The prediction was based on the recognition of common biologic and pathogenic characteristics of AIDS and animal retroviral diseases. This prediction guided many of early experiments in the find to etiologic agent of AIDS. Later, after human immunodeficiency virus HIV was discovered, its morphological similarities to equine infectious anemia virus, a prototypic member of genus lentiviruses, family retroviruses, was the key to unbelievingly confusion over the fact that the human virus killed host lymphocyte rather than a transforming them as typical oncogenic retroviruses would do. Ever since, the essential quality of comparative medicine has been guided HIV, AIDS, experimental design in many areas including drug design, diagnostics and vaccine development. Thanks for listening. Chapter number 2 from book Murphy Virology.